Platform 3, that is assessing needs and planning care. As a registered nurses prioritize the needs of people when assessing and reviewing their mental, physical, cognitive, behavioral, social, and spiritual needs. They use information obtained during assessments to identify the priorities and requirements for person-centered and evidence-based nursing interventions and support. They work in partnership with people to develop person-centered care plans that take into account their circumstances, characteristics, and preferences. So here they are saying that as a registered nurse, we should know to prioritize the needs of people. Yeah. And while assessing, that is while revaluing or evaluating, so while we evaluate their health, different personalities, different people, they have different needs according to their health conditions. Many factors it affects or it decides what choices they make, yeah, and what are their needs and what care we are supposed to take according to their evidence-based tests. So whatever care we take or treatment we follow, or we make any choice or we decide a particular treatment or care, it should always be that person centered according to that person's need. We should work in hand. So the decisions which we make, it should be directly related to working hand in hand with that patient, yeah, according to different characteristics and their preferences. We have to take them into consideration. Outcomes: the proficiency identified below will equip the newly registered nurse with underpinning knowledge and skills required for their role in assessing and initiating person-centered plans of care. So the care which we take, the plans which we make, it should be person-centered. Demonstrate and apply knowledge of human development from conception to death when undertaking full and accurate person-centered nursing assessments and developing appropriate care plans. So she should have the knowledge through from the time of conception, is like right from the baby, a woman conceives, yeah, and till the time of the death. So every other factor affecting this part or the important things from conception to death, the nurse should have the knowledge of everything, and accordingly she can make her decisions, can decide proper care plan for people. Number 2, demonstrate and apply knowledge of body systems and homeostasis, human anatomy and physiology, biology, genomics, pharmacology, and social and behavioral science when undertaking full and accurate person-centered nursing assessments and developing appropriate care plans. So in this outcome, you will everywhere see that how a nurse should be well equipped, that she can make a proper person-centered care plans. All the aspects the nurse has to take care of. Here, as all the studies are written, like she should be knowing the homeostasis, human anatomy, physiology, biology, genomics. So it means that the nurse should be knowing anatomy is nothing but the structure of a human body, homeostasis is nothing but how it works, physiology, yeah, then how the body functions, biology, what all things we need for survival, then when, and all the things like pharmacology, genomics, as we already saw the genomics. So every other aspects of your health, right from the body, how it functions, how the genetic functions, what are your characteristics, how the structure of body is, everything the nurse has to take care, means they have to analyze, or accordingly she has to make evidence based, or she has to make the person centered care plan. Demonstrate and apply knowledge of all commonly encountered mental, physical, behavioral, and cognitive health conditions. Medication usage and treatments when undertaking full and accurate assessment of nursing care needs, when developing, prioritizing, and reviewing person centered care. So, she should apply all the knowledge which she has. It can be related to mental, different settings, yeah, wherever, whichever condition it is, she should have apply all that knowledge, and the medication usage and treatments. So here the nurse should be having all the knowledge about different conditions, about the medications and how they are used, about the treatments, and accordingly she should make a nursing care plan for that person. Understand and apply a person-centered approach to nursing care, demonstrating shared assessment, planning, decision making, goal setting when working with people, their families, and communities and population of all ages. So, whoever you're working with a group or with an individual or with the community, it should be person centered approach only. Whatever care you are giving, public, the person is your main motto, his needs are your main motto. Accordingly, we should assess, review any plan, as I told you in the previous part. Demonstrate the ability to accurately process all information gathered during assessment process to identify needs for individual nursing care and develop person-centered evidence-based plans for nursing interventions with agreed goals. So whatever aim you have, whatever is your objective, you should have that ability, that the information what you gather also while making a care plan, you should know how to use it in a most appropriate manner to, and how you can evaluate, how you can make the assessment and make a person-centered nursing plan. Effectively assess a person's capacity to make decisions about their own care and to give or withhold consent. You should know that people are vulnerable. We should understand whether the person is able to take their own right decisions or not. Even if they are not, we should make sure that how we can help them to take right decisions. And if they are, we should respect it, and accordingly we should influence or give them proper suggestions and take their suggestion or take their decision in account. Understand and apply the principles and processes for making reasonable adjustment. We should know what are the principles and how to apply them during the care, and wherever necessary how to make adjustments, reasonable adjustments, so that the patient's health is not harmed. Understand and apply the relevant laws and mental capacity for the country in which you are practicing when making decisions in relation to people who do not have capacity. So you should know the rights and regulations and the laws of that particular country where you're working, and what are the patient's right, if they are vulnerable or not able to take their own decisions. What are the ways? What are their rights? And accordingly make your decisions. Recognize and assess people at risk of harm, and situations that may put them at risk, ensuring prompt actions is taken to safeguard those who are vulnerable. You should be able to understand the patient's condition, their mental, physical, why they are vulnerable, what is their condition, and accordingly we should assess them. And if they are harming themselves or they are at any risk, accordingly act on it promptly. Next is demonstrate the skill and abilities required to recognize and assess people who show signs of self-harm or suicidal ideation. So we should be able, we should have that much of knowledge, that much emotional intelligence also should be there. Also we should have that ability to see and recognize that if there is some fishy thing happening in patient's behavior, are they going through any mental trauma, or are they going to self-harm themselves, or any suicidal indication. If you see, we should make sure that we take prompt action and we note down all the things to make things safe for them. Undertake routine investigation, interpreting and sharing findings as appropriate. Investigations, routine checkups, investigations, the meaning means whatever the investigations are there, we should be able to understand it, interpret it, and share the findings with people around us. Means share the findings, that is the colleagues which we are working with, we should be able to tell them. Then next is interpret result from routine investigation, taking prompt actions when required by implementing appropriate interventions. That is, appropriate interventions is nothing but when you talk to the public or when you talk to the patients about the things what they are going through based on their investigations, and requesting additional investigations or escalating to others. If anything is needed, further investigations are needed, or any assistance is needed, we should be able to know where to approach. Demonstrate an understanding of comorbidities, that is, the person, if they are having one or more disease condition or disorder, we should be able to understand it, and the demands of meeting people's complex nursing and social care. So see, we come across different challenges. We come up across different challenges where we are supposed or we are asked to take actions regarding the complex health issues. So we should be able to do it, and we can only do it if we have a knowledge about it. Identify and assess the needs of people and families for care at their end of life. Whatever the needs of the patients who are at the last stage of their life, we should be compassionate, and we should be sensitive in our communication with them as well as their families too while taking care, including requirements for palliative care and decision making related to the treatment and care preferences. So palliative care is nothing but the care of the people who are having serious issues, health issues. So we should be little more sensitive to them. As it is, we are going to handle everyone with care, but we should make sure that we know how the people react to different things. And accordingly care and preference should be given. Demonstrate the ability to work in partnership with people. We should know how to work with people, coordinate with them, the families and carers, to continuously monitor, evaluate and reassess the effectiveness of all agreed nursing care plans and care, sharing decision making, readjusting agreed goals, documenting progress and decisions made. Whatever we do for assessing, for revaluing, or readjusting our care, or making any decisions, we should work hand in hand with the patient, with their families, with our colleagues, so that we give effective care to them. Demonstrate the knowledge of when and how to refer people safely to other professionals or services for clinical intervention or support, taking in consideration their information, their privacy, and everything, and their circumstances. We should know whom to share information with for further assistance if needed. We should be careful while doing it. All this content belongs to NMC. We are just explaining the points so that you all can do your self study. The further content is in the next video. You all can see the link in the description box. We are taking effort to make all these things for y'all. So please y'all also make an effort to like and press the bell icon and comment if you really liked it.